Hi, and welcome to Flexibility and Spine Health, our mobility module. This is an important module to me because this one we kind of start to visit a very unique aspect, at least into my professions, because I see a lot of folks who, because of our sedentary lifestyles, have left themselves in a bad spot where they're just not mobile like they used to be. And by that, I kind of mean like I'm sitting in my chair right now doing this video, and my legs are moved out in front of me. And so people, by virtue of sitting, they get tight hips, but also look at my knees being bent. Those bent knees mean that my knees start to get tight as well. And, eventually, if I'm sitting long enough, I will fail to be mindful of good posture. And that is coming here in just a few moments where we'll talk about posture in the next video. But inevitably, I'll let myself kind of slouch down. And when I do, what you can see about my head is it's extremely forward on my shoulders. And no doubt that's happened to all of us. And that just comes from, general fatigue or inattention to what it is that we should be doing while we're sitting or standing or walking or any types of locomotion that may come our way, or just being static. Maybe it's you have bad posture when you're asleep and you're not lying the right way. And so I'm going to invite you in to look at that video very soon. But in the meantime, let's talk about this thing called flexibility. And I want you to keep in mind that we need proximal stability, which is not mobility, but we need proximal stability for distal control. Stability at the core or at the trunk, meaning the belly, the pelvis, and the legs, the upper legs, are critical in maintaining long-term health. So that's kind of the direction we're going to spin today. First of all, flexibility is just your ability to move through a range of motion. And no doubt, most of us probably could look at one area or another and identify that we have maybe some mobility issues. That could be at the ankle or the knee or the hip. It could be at the spine, possibly at the shoulder or the neck. Maybe it's at your jaw even. And so those issues do arise. And we have to look at this in that movement limits a specific joint is that we see what normal should be. And the American Academy of Orthopedic Surgeons have kind of came in and they said this is what normal should be. And obviously with different people it's going to change. But that movement should be pretty free. And it should be definitely pain-free. And so pain is an inhibitor that comes into play, but also just sheer lack of use will cause some mobility issues. And so we're going to keep that in mind too as we venture through this. So there's one primary modality that I will use, both in physical therapy as well as in athletic training, but also in fitness, to help offset the limitations that immobility or joint or soft tissue restrictions play in part of our patients and clients, and that is stretching. Stretching is something that every one of us need to be doing regularly. By regularly, I mean 2 to 3 days a week at minimum. And if you're a pretty active person, maybe that's something that you do at the conclusion of your activity when that muscle is nice and supple. We break this down even further and we say there's static stretching, which you'll see in a video below. There's also dynamic stretching. And dynamic stretching is typically more of the warm up to exercise. Static stretching is typically the cool down to exercise. And that's really how you can integrate these two things to guarantee that you are meeting the needs that are necessary for your own health. So next, we need to talk about the benefits. Forgive my spelling error right there. The benefits to stretching and flexibility. I've linked you to this resource of lifespanfitness.com, which is an incredible article about how flexibility matters to older adults. and the importance of that. But number one, it will immediately start reducing your risk of falling. Again, falling really becomes a problem at age 65, where it takes over as the number one cause of death. Number two thing here, though, is it reduces back pain and arthritis. And you're going to see down below in my video over how to do a back flow. That's kind of a yoga term, but it's my 4 or 5 exercises that I'm absolutely in love with in making sure that my spine is either in great health, or when it's not in great health, because I've wrecked it. These are the things I'm going to do almost immediately. So I hope you like that. Leave me some comments on that. Number three, improve mobility and posture and balance. We're going to give another video to posture and show you kind of how you can do a quick assessment on your own posture. But with that, we're going to give you some cueing on some things that you might want to start doing. And then finally, it's going to improve your blood flow. And that happens by getting some blood into areas that may have been restricted before just by simple virtue of restricted range of motion. So all very, very good things and things we need to consider. Now, there's some determinants on how flexibility is allowed in the body, and it's very much multifactorial, but also it integrates to one another. And this has to do with your nervous system. The nerves that are going through your body really respond to tension changes. And then also your joint structure. Some of us have joint structures, and forgive me if you're one who uses this term double jointed, but that's just not something that anatomically describes correctly what it is. A person may have some hypermobility, some increased mobility in a joint. They're not truly double jointed. They don't have 2 knees on the right and 2 knees on the left. They just have some hypermobility. And so we've commonly referred to that in the past, but that dictates a lot about how mobile you are. And then finally, your muscles and tendons. I mean, if you see a guy in the gym and he has these massive arms, he may not be able to get his forearm close to his shoulder just because of the bicep girth that's there. And that comes up a lot too. And so we have to kind of consider a lot of different things that come up with our mobility. And just because you do have a lot of muscle doesn't mean you can't be mobile. And just because you don't have very much muscle doesn't mean you can't be mobile or you're hypermobile. Tone is a very unique thing, and that goes back to that nervous system component, which is actually far beyond the scope of this class. But if you'd like to learn more about that, come see me and we'll talk more in depth and do a deep dive there. If you came to me and said, listen, Kendall, I want you to assess my flexibility, I would probably run you through some very simple tests. Neither one, which would be the pictures below. One of these pictures here is the sit and reach test. Another thing here is use of a tool called the goniometer. I find that some more functional movement screening is much better for the general public, and you're going to see me perform those as well. And that's part of that posture screen, but I just went ahead and lumped it into that video. But that is partially because these tools, while maybe they kind of would help me to understand if you had a pathology present, for instance, in this elbow, this one here only looks at hamstring flexibility. Very rarely does it incur the shoulder. And so I would just say, if you came in and you said, I need to assess my flexibility, I'm going to tell you that assessment is important, but your day in, day out, what you're doing every day to affect your flexibility is by far more important. Because we can always find out where we stand just by simply putting our feet together, hands going down to our toes, and recreating this right here without a special tool. And that's a very simple way of standardizing the test and looking to see just how flexible our hamstrings are, but also it gives us immediate feedback because we feel it here behind our knees all the way up to our butt. And so we know if we're improving our stretch just by virtue of how far our fingers are towards our toes. Maybe they're beyond them, maybe they're not, maybe they're a foot away. But that's a very quick assessment that you can do daily, and you need no professional assistance to do. So the ACSM is the American College of Sports Medicine. They recommend that flexibility training happen about 2 to 3 days a week. And I'm using the ACSM because our physical guidelines from health.gov were not very specific here. And so I wanted to kind of bring in a new group. The American College of Sports Medicine also agrees with physical activity guidelines from health.gov on both the moderate intensity aerobic activity as well as the amount of days a week you should be strength training. So this just goes right in hand with that. The intensity is simple. You're going to stretch to the point of discomfort. Now, discomfort and pain are two different things. If it hurts bad, then that's not discomfort. Discomfort is, oh my goodness, I really feel that stretch. And then you're going to hold that. I have listed here 30 seconds. I would also tell you this. More is generally better if as long as you can handle it. I prefer a stretch to last somewhere around 90 seconds. Sometimes for therapeutic purposes on certain tissues, I will hold that up to 3 minutes, especially if I'm doing the stretch for the patient or the client. And then your type is based off of your temporal goals, meaning what is it you're trying to do? And that goes back to the first part of this talk where we said there's dynamic stretching, there's static stretching. And that has to do with what part of your workout or what is it that you're trying to do. Are you trying to warm up tissues to exercise? That's dynamic stretching. Are you trying to get some long-term extensibility in that tissue? Then that probably either happens after exercise or independent of itself, and that's where static stretching comes in. Our flexibility drills, again, static stretching, you're going to see the video below, dynamic stretching, ballistic stretching, proprioceptive neuromuscular facilitation, which is by far one of my favorite therapeutic techniques. I try to incorporate this on nearly every one of my patients. Many times you're going to hear this probably spoke only about in physical therapy or athletic training settings, but PNF has a great value. And again, you're going to see that in a video coming soon. But the last thing here is our foam rollers. So when you go down to my video on drills and tools, you're going to look at this, and I really want you to think about what does that foam roller doing? Well, it's pressing into the tissue, and as it presses into the tissue, it subtly elongates that tissue. And when it subtly elongates that tissue, you're going to get a stretch. The physiology is going to occur that is stretch, but it's not always seen as a typical or conventional stretching technique, but that's what it's doing. It's also giving a little overpressure and massage. So these are, again, things you can do without having to consult to a professional. You can do this especially in your own home, but as frequently as you would like to do it. Spine health brings up some new things that we haven't quite addressed yet. And number one is this is the number one reason for lost days of work. And I want to address this simply because when you consider employment as well as income and how important that is to you building wealth, but also into maintaining safety for your family, your days at work are very important. And so if you're going to miss those due to a spine injury, then really it's kind of one of those things where, and I kind of sound awful by saying it this way, but if you have a flat tire, that's bad luck. And, you know, a lot of times in our health, we have flat tires where we get a virus or we have an accident. But if you have a day where you run out of gas in your car, then, and we've all probably experienced that, then honestly, that kind of falls back on you because you should have been monitoring the gauge. And if you didn't monitor the gauge and you run out of gas, it's always going to happen at the worst possible time, like when you're late or when you're about to be late or when you really need to be somewhere or your wife is pregnant and having a baby and you need to get her to the hospital. And so this is a preparation thing. And so back pain, many times, unless it's genetic defects, will probably be more along the lines of you ran out of gas, dude. And so you got to prepare for that. Um, some big risk factors that are out there. Number one is age. As you continue to age, your stability or muscle function goes down. Remember, we saw that after 35, and so as muscles weaken, back pain chances or risk increases. Number two, fitness and function. And the way I want you to understand this is if you're not doing anything fitness wise, you have a pretty low level of fitness. What you're doing is the same thing as aging. You're letting those muscles weaken, and therefore you're increasing your risk because you don't have that core stability. Remember, our very first comment at the introductory slide was proximal stability for distal control. That is of the core. So the belly, the hips, the pelvis, and the upper legs, especially that of the buttocks or glutes. Very important muscles for training to keep spine health in check. Number three is pregnancy. And this comes about because as that baby develops in the belly of the mother, what we know happens is that belly starts to expand, and that places a lot of stress on a spine. And if that spine had a very low prior level of fitness or function, then that belly going out only compounds the stress on a very weak back, meaning we're going to have back pain. Do all pregnant women have back pain? I have no idea how to answer that question. It wouldn't surprise me, but I do have to say this. There are ways to offset or modulate the back pain that is experienced with pregnancy. I don't want you to think, though, that pregnancy back pain is the same as running out of gas, because I'm not going to go there. If you have back pain and you're pregnant, you deserve all the care and all the love and all the help I could ever give you. And you get a total pass on running out of gas or having back pain. Number four is weight gain and obesity. We know that as that belly comes out further, especially from weight gain and obesity, again, it's placing stresses that are uncalled for on the lumbar spine. And so, what you need to understand from that perspective is if you have back pain, the first question that your healthcare provider should be asking is, are you doing anything for potentially uncontrolled overweight or obesity? And so if your answer to that is no, then the first thing that we would tell you is definitely see the practitioner, get the acute care out of the way, but then long term, we need to be thinking weight loss to prevent this from happening again. And I can tell you that both in physical therapy and in athletic training, many of our back patients that we see have a weight issue, and that is transitioning that lumbar spine into a higher lordotic curve, which is not what you want if you have back pain. Genetics is another issue, and this kind of hits home with me because my father had a degenerative disc disorder, and so I really pay attention to this a little closer. I've had some back issues, I've had some disc issues, and I do not want those to occur very frequently. In fact, I am completely focused on doing strength training 3 times a week and really focusing in on my core, and then while I'm doing that, doing protective things for my core. I have some comments to make about weight belts. I'm going to let some other professionals do that though, so that you can see why that weight belt comes in. I do personally wear a weight belt, especially for things like deadlift and squat, but there is some relative, I'm not convinced information out there though about why weight belts are not good, but I'll let you make the call. Occupational risk, again, an area where you may see a weight belt come in, more of a lumbar belt, but there are many jobs, especially those where people are bending forward and then coming up and twisting. This is the motion where we see, and a lot of occupations have that, especially in factory work, where high risk of lumbar spine injury occurs. Also, injuries from improper lifting techniques. And so, if you work a job that requires a lot of lifting, there's a good chance that you're going to see some spine injury in there somewhere. Mental health also has something to do with this, and what we know is that stress directly correlates to especially neck pain, because if we have a lot of stress, then we tend to shrug our shoulders up. You know where this is, and typically it's a postural strain issue that goes away as soon as you fix the posture and activate those muscles. But the other side of this is when it doesn't go away, it's over long-term stress and strain, could change postural habits, possibly permanently, but that has to do more with habit, and that's what posture is. It's habit. You're going to hear me say that again soon. And then the last thing on here, that's effective of our kids, backpack overload. How many times have you seen a kid and they're lunched over really big? Maybe this is you in college, where you're lunched over really big and you're carrying that backpack because you're trying to offset your center of mass and push it over your hips. And that's just absolutely terrible, because now you got this load forcing your body into forward flexion. It's an incredibly bad position to be in, but yet we still see kids doing it. So what do we do there? Do we fix that by telling kids they don't have to take these books everywhere? Um, wow, there's so many things to be said there. As I've said in the past, I am an advocate for changing school times. That 8 o'clock is just stinking too early. Especially for the kid that's got to be on the bus at 6. But you know what? That's probably not a problem that personal health and wellness is ever going to solve. But I'm at least putting the bug in your ear. What causes back pain? Well, there are strains and sprains, and these are muscle or ligament issues. And that's typically faulty mechanics. There's also discs. A disc is the spongy area between the vertebral bodies or the bones of your spine, and those can be injured, and very much cause disability. We see a lot of disc patients, typically between 35 and 50 is where a person's going to have that happen. I was a classic case. I was doing squats. I got cute with it. Bam, popped a disc. Took me out of running and put me on a bike for several months before I could return to running. It was terrible for me. But the other thing here is spondylosis and spondylitis. Two very different things. Spondylosis is an arthritis of the spine. Spondylitis, excuse me, is also an arthritis of the spine, but it is of rheumatoid descent. And so those are two very different things. Both cause early onset back pain, um, and are very difficult to treat, mind you. But with the right stability and sometimes with the right medications, especially as it's referred to as spondylitis, then we can treat it. Disc degeneration, where the disc is just starting to wither, and that happens very much in our aging population, the baby boomers. We're seeing a lot of that. Spinal stenosis, where the spinal column goes through the vertebrae, and actually the narrow or the canal that it does begins to narrow, and that could be from several reasons, but that places a bony block around the spinal cord, which is very dangerous and very painful. Scoliosis, that is an abnormal lateral curvature of the spine, and so the spine should be very straight up and down, but when it starts to laterally or to the side bend, your spine has natural forward and reverse curvature, but when it laterally or side bends, that's not a good thing, and typically that's something we see if it's going to be long term, structurally, and very early on in life. There is the group of patients that where this occurs, and it's called functional, and typically with movement, it does resolve. Last thing here is a tumor can cause back pain, and certainly if there's a tumor present, you need to make sure that you're looking at that. Some ways to prevent back pain. I just wanted to share this quick study with you before you view my backflow video. Number one, the current evidence suggests that exercise alone or in combination with education is effective for preventing low back pain. And that's just a statement that was released in the Journal of American Medical Association in 2016. They looked at 6,133 studies over back pain, and they did this meta-analysis and said, look, if you just exercise and then possibly know a little bit about back pain, then you're going to offset back pain. It's not going to hit you as much. It may still come out. Listen, accidents include just making faulty mechanics happen. You chopped too much wood, you replaced a floor in your trailer, you reached down to grab a awkwardly placed bottle of dish soap underneath your cabinet. Tons of things can happen to cause back pain that we had absolutely no idea could happen. What I'm trying to convince you of right here is that if you put gas in the gas tank, you have less likelihood of running out of gas. Now, again, accidents happen. Something could pop that gas line. It could just break and fail. Gas could drain out. You didn't notice. Now you're out of gas. So I want you to consider it that way. There are obviously other factors involved, but consider it that way. Are you keeping gas in your gas tank? You are equipped now on knowing exercise, especially that exercise alone or in combination with education is effective for preventing low back pain. So, will you prevent your own? It's all dependent on you. Fill up the tank and let's see. Number 2, posture is first, and it starts at your head. You're going to see my video here in a little bit, and you're going to understand that a little bit more. Number 3, follow the 2 to 3 days a week of strength and flexibility testing. Number 4, corrective exercises. Check out my spine flow video. If you need to consult a practitioner, please do so. Start with your doctor. If your doctor is just interested in giving you medications, then you ask for a referral to physical therapy, to athletic training, to chiropractic. You do whatever you need to do to get good physical care for that back pain. Don't just treat it with a medication and expect it's going to go away. Again, look at that journal of American Medical Association. If they would have put in there, back pain is treatable exclusively with meds, that would be one thing. But they really pinpointed exercise as being the #1 modality there. And then the last thing, give it your attention. Education is key. Go unlock the door. I hope that you enjoy the rest of the videos. I'll see you.